it's been a very lonely journey. I've been doing this sort of medicine for, well, nearly all my life. And all sorts of other things along the way. I'm a family therapist for the family court, and I ran a horrible clinic called the Obesity Clinic for people who needed surgery in Christchurch, all sorts of different things. And it's lonely. And so a lot of what I've done has been with people who are not medical. And when I saw this, I was really excited. I thought, well, this is a chance to see some new people, meet some new people. I saw some of the speakers. I actually sent the details of the conference to Dr. Glenn Davies. I said, hey, I don't know if you've seen this, but it looks fantastic. And he said, oh, yes, I have. I'm speaking. So that reinforced what I was feeling. So I wouldn't have missed it for the world. I'm almost 80, and I've been a doctor for many years, and I call myself a medical rebel. I think it started because I got myself born in China, and I lived under communism for 2 years, and I was a redhead, curly redhead, and that is very different. I used to get kidnapped, and so all my life I've been different. And I think that really helped when I decided I wanted to do medicine, because my school told me I couldn't. No, you don't say that to a redhead. So I had the advantage of meeting my husband at med school, and he's now died, but he was the only preventative cardiologist we have here, and probably one of the few in the world, and preferred to reverse heart disease. But I had the advantage that if I said I was unhappy with medicine, and I was very unhappy when I first qualified, he'd say, go and find out about it, something or other. So the very first thing I did was a course on listening with love. And that was the end of 15-minute appointments. You can't listen to a patient in 15 minutes. So most of my life, I've had an hour and a half for a first appointment. And when you do that, you practice changes, and you start to get people who really want to talk. They want you to solve their problems. And medicine to me is like a game of pickup sticks. At the start, if you know that game, it's really hard beginning, and then at the end, it's very easy. And I think health is like that. It's pulling apart a problem. But the lovely change that I've seen has been from doctors talking and ordering and telling to listening. And it's really suited my style because I'm really interested in people. I used to say people are my hobby. And I want to know what people are thinking, what makes them tick. And so very briefly, what I do now is I work with people who are chronically ill whose problems are massive. They want them unpicked. And I talk to them. I ask them why they've come. Then I ask them to draw a pie chart. And I say, if you went to Domino's and you got a pizza and brought it home, how would you feel if you opened the box and it only had 7 pieces in it? And they're usually very unhappy about that. I said, well, maybe life is a bit like a pizza, and we often have pieces missing. Would you like to help me fill in your pie chart? And so I talk to people about what they do, what they think health is, what they do to help themselves. And then there's often, I have a lot more than 12, but I have sometimes 16 bits. And there's a lot of room to add things. And so I said, there doesn't look anything much fun in this. Do you laugh? Do you have fun? And that gets them thinking differently about some of the lifestyle things. And so we go through some of the lifestyle things. I try and draw it out of them. And then I say, okay, well, let's see what, we can do about it. And I go from there. When I was 68, I decided it was time to retire from my practice. And I deregistered myself. I discovered I was writing very few prescriptions. And I worked it out financially that it was costing me about $300 every time I wrote a prescription, which I did very rarely. So I thought, well, if you relate that to our registration costs. So I thought, right, I'll deregister myself and I will work as a medical life coach. And I've called myself different things at different times. And And that's really what I've been doing since then. Unfortunately, my clients, who I call them patients, won't let you retire. Um, I have done most of my life, I've lectured all over the world. I have helped develop quality supplements that are actually needed. Like, I remember some years ago, 8 billion Red Bull was sold in New Zealand. It's an awful lot of Red Bull. And I said to some scientists in the States, can't you make a healthy energy drink, low sugar? Yeah. I said, well, why don't you do it? So, that's the sort of thing. And so now I still see people. Because I used to travel so much, COVID has actually been very kind to me because now I don't have to travel so much. I can work on Zoom, phone calls, WhatsApp, all sorts of apps. And a couple of months ago, I was supposed to be in Malaysia, but I didn't have to go. It was really nice because it's very hot in Malaysia. And so a lot of what I do is, especially since I've become a life coach, a medical life coach, and I haven't done the PREKURE course, is I teach people how to train their doctors. Because in my book, unless doctors understand a new approach to health, they're not going to get anywhere. But I said, you need your doctor on your side. You want him to really understand what you're doing. And there is a very good way to do it. And I can tell you because I'm a doctor, I can tell you from experience. So I say, first of all, I want you to do a few things. You've got your pie chart. I would like you now to make a list of all the things that you think are wrong with you, your sleep, whether you have pain, where it is, all those things, your digestion, your gut, your energy levels, everything you can think of. And it doesn't matter whether you don't think it's relevant, put it all down. And I said, try and get it on one page. Then copy that 3 times. Then pick the first chart up and write some comments. So if you don't sleep well, describe it or rate it 1 to 10. Then you fold that sheet up and you're not going to look at it. In fact, you're going to do the second sheet in a month's time and the third sheet in another 2 months' time. So that's a 3-month span. But when you've done your first sheet, then you take your pie chart and that sheet to your doctor and say, Doctor, I wonder if you could help me. I'm really wanting to make some lifestyle changes in my life. And I'm really not happy with the way my health is going. And I want to get healthier. I want to get fitter. And I want to bring some things into my life that I haven't really done before. And the key, doctor, could you monitor me and see if it's working? So could you do a blood test on me and look at my cholesterol and see what my blood sugar's doing and whether my liver's okay and my kidneys, and maybe check my thyroid. And a friend said I have to have my TSH done. I don't know what that is, but if you could possibly do the TSH and something like that. Now, doctors really want to help their patients, but they don't know anything very much about lifestyle medicine. Some of them do, but a lot of them don't know a lot. So what you're actually doing is helping your doctor to open their mind to a new way of thinking. And doctors are really keen to do this because if you say to your doctor, if I bring more fun and laughter in my life, will it help my health? I don't know, probably would. But if you actually ask for his help and his evaluation of what you're doing, it's quite a different category. And that's what people do. And that way they get their doctor on side, they educate their doctor, they get all the tests they need. Many of the people who come and see me with chronic illness are very low income. Often they are on a disability allowance. And people don't realize that for maybe 20 years now, people can fund some of the costs of a lifestyle like supplements, diet, if you're on a disability, up to $200-300 a month, which is huge. But the doctor has to recommend it. So the doctor can't recommend it if they don't really understand it. But if the doctor can see your first chart when you go, and then you say, well, can I come back in a month and see how we're going? I'd like you to check my cholesterol hasn't gone up, those sort of things. Then when the doctor sees that there's no worsening of those parameters, and he looks at your sheet and says, oh, you used to not sleep very well. You couldn't get to sleep and you'd wake up at 3 a.m. And you're now saying that you're sleeping better. So that's a very positive thing for the doctor. And the doctor is then able to say, well, I think what you're doing is good. Unfortunately, funding doesn't extend beyond people who have a disability at the moment, and they have to be low income. You can't have a couple of rental houses or something. It doesn't sort of apply. So it's means tested. So, and that's what I do. And that's how I get people to talk to their doctors and help their doctors. And, gradually it'll change medicine. So getting more doctors becoming life coaches.